Assalamualaikum and a very good day I bid to our respective lecturers. Today we are from Group E2 will be presenting on our medicine of choice known as bromhexin. This group consisting of 7 students. These include Nurhanis Edina binti Murtaza, Nur Iluni Hayati binti Nur Azmi, Nurin Nisa binti Ahmad Zamri, Nurul Akila binti Muhammad Kamal, Nurul Shahada binti Zaharuddin, and last but not least, we have Raisha Safia binti Talib. So here are the presentations outline that we have drafted for today's session. Firstly, we will start off with introduction of bromhexin, followed by 2 R's, which are right route and right time for bromhexin. And thirdly, we have bromhexin used in elderly and children. Number 4 would be the counseling advice on the usage of bromhexin. Last but not least, we have advocation use of bromhexin. Let's begin with a brief introduction upon bromhexin. Prior to that, we have come up with the expectation that commonly pediatric and elderly are the two most common prevalent groups that experience coughing. That is why we have proposed bromhexin as the medicine to be presented by us. Generally, the use of bromhexin or the indication of bromhexin is for coughing. This is because bromhexin is referred to as a mucolytic agent. It acts on the mucus gland in the respiratory tract to change the structure of bronchial secretion. Other than that, it enhances the transport of mucus by reducing its viscosity and increases ciliary activity so that it can result in enhanced mucociliary clearance, and eventually it helps to relieve productive cough by thinning the phlegm in the airways and facilitating the removal of the mucus. Other than that, it is also essential for me to mention that the dosage form of bromhexin is in syrup as shown in the slide, and this brings us to the conclusion that bromhexin is supposedly to be taken orally as advised by the pharmacist.
What are the 5 rights of medication? The 5R rule is a support for drug control in relation to patients and a safe administration of medication. R stands for right and aims at the right patient, the right medication, the right route, the right time, and the right dose. The 5 rights of medication are applied to avoid errors when sorting, dispensing, and administering medication. If mistakes are made in the administration of medication, whether it affect dosage, allocation intake, or administration, the consequences can be serious. Firstly is right patient. Take a careful second to look to ensure that the name on the bottle matches the patient. This is especially important in households with multiple people on different medication. Be sure to double check the patient's name on the medication label. Next is right medication. First of all, before giving the medication, you want to make sure that you have the right drug. Make sure the medication that's being administered is identical to the drug name that was prescribed. The other important thing to know about the right medication is knowing the strength of the medication so you don't give the wrong amount. Strength is how much of the active ingredient in one dose. Many medication come in both children and adult strength, so there's a potential for great harm if you don't know the strength. That's why knowing the medication strength is just as important as knowing its name. Is right route. Drugs should be administered at the appropriate site in order to obtain the desired effect. The route is the way the medication gets into the patient's body. Make sure you are taking the ordered medication by the right route. Check the order to see which route is specified and confirm that the route is appropriate for the medication and the patient is able to take the medication by the ordered route. Always ask if you're not sure how to give the medication. As for bromhexin, it comes in the form of tablet or syrup and it is to be taken orally. Next is right time. The right time is time at which the prescribed dose should be administered. Daily drug doses are given at specific times during the day to keep plasma level within desirable concentration. So, bromoxine may be taken with or soon after food. Medication can be scheduled to be given at a certain hour. Always refer to the medication instruction to know what you should be looking for, so you know the right time to take the medication. Check the frequency of the ordered medication and be sure to confirm the time that the last dose was administered. Lastly is right dose. Dose is how much medication to give. This is important to know because no matter what type of medication you are giving, if you give too much, there could be some adverse effects. If you give too small doses, the medication won't work as it should. An error in dosage can occur if the caregiver does not first check to make sure the prescription is the correct strength for the patient. So in conclusion, one of the recommendations to reduce medication errors and harm is to use the five rights: the right patient, the right drug, the right route, the right time, and the right dose.
Hello, I am Nur Akila. Today I'm going to elaborate on how bromhexine may be used differently in elderly and children. So do you guys have any ideas? No worries, come us and let's explore it with me. So elderly also categorized as adult. However, there are several elderly that need special adjustment in dose and also having difficulty in swallowing. So there are two dosage forms of bromhexine suggested, which are tablet and oral solution. For tablet, recommended dose is 8 mg to 60 mg for 3 times a day. Meanwhile, 10 ml to 20 ml 3 times a day. For bromhexine HCl, 4 mg per 5 ml oral solutions. So for elderly who are able to take a tablet, going to consume tablet without lowering any dose unless needed. So oral solution might be suitable for elderly who might experience difficulty in swallowing and thus increase patient adherence. So lastly, the usage of bromhexine need to be consult on concurrent medications, especially antibiotic, as elderly tend to have polypharmacy. Now, let's move to the usage of bromhexine in children. So as we all know, patient medication adherence for tablet in children is low. So as the alternative, bromhexine commonly used in liquid dosage forms such as oral solutions. So next, I'm going to focus on the dosage of children, which can be categorized as less than 2 years, 2 to 5 years old, and 5 to 12 years old. Okay, so for less than 2 years old, recommended dose is 1.25 ml for 3 times a day, and for 2 to 5 years old, 2.5 ml 3 times a day, and lastly for for children 5 to 12 years old, 5 ml 3 times a day of bromhexine HCl 4 mg per 5 ml oral solution. So if do you notice that dosage for children are lower than elderly or adult dose? This is due to the children GI absorption is lower than adult. Plus, bromhexine having characteristic of crossing blood-brain barrier, so the lower dose needed as children blood-brain barrier is more permeable. So that's all the points on how bromhexine used differently in elderly and children.
Hi. Can I help you? Could you find me something for bad cough?
Oh, sure. Is it for yourself or someone else?
For me and my grandchild.
Before that, I need to ask you a few questions to make sure the medicine that I give is safe and effective.
Sure.
Okay, maybe you can explain to me about your problem or some description on your symptoms?
I've been sniffling for the last 2 days and it's made me very upset. This girl,
I keep coughing a lot too. How old are you, kid?
7 years old.
Okay, so I have noted here. So for 2 days, you have been sniffling stuffy nose, right?
Yes. It's probably closer to 3 days, but the last 2 days have been the worst.
Do you have any allergies on medication or what?
No.
Are you taking any medicines on daily basis, like over-the-counter drug or herbal natural product?
No.
I take vitamin C every day. Is it okay, doctor?
Oh, vitamin C, that's okay.
But my grandma take an eye drop every day. Is it only, I guess?
Oh, do you know what it's called?
It's for glaucoma.
Yes.
So both of you have any other symptoms like dizziness or fever?
Right now we are okay. Just at night we have fever and flu.
Oh, I see. It sounds like both of you just have a common cold. So for the cough, I would suggest bromhexine. Which one would you prefer, tablet or liquid?
We prefer
Liquid.
in liquid form.
Oh yeah. Okay, so for you, you have to take 20 ml 3 times a day, and for you girl, take 5 ml 3 times a day. And then I will provide both of you with measuring cup and shrink.
Doctor, yeah? Does it make me sleepy because I have school tomorrow?
Wow, you are so clever. Actually, it is a common side effect to cause sleepy, dizziness, vomiting and nausea. But if there is any serious adverse effect, please go to the hospital, yeah?
Okay.
Thank you very much.
Bye!
Yeah, my pleasure.
From the previous video, we have illustrated the real situation of a counseling advice that usually happen in pharmacy between a patient and a pharmacist. There are a few points that can be highlighted. Firstly, it is important for pharmacy to play their role. They need to know about the patient details like their name, age, medication that has been taken. Other than that, history of the illness and symptom are also crucial. This is to ensure their safety and efficacy when a pharmacy dispenses certain drugs needed for the patient. The pharmacy should give suggestions for appropriate medication for their illness. For example, in the video, the pharmacy prescribed bromhexine to the kid and the elderly as they had been coughing continuously for a few days. Here we know that bromhexine can be used for both types of this age category, but different doses are needed. This is because inaccurate doses may lead to adverse effect, toxicity, or lack of clinical effectiveness. For example, the pharmacy gives 20 ml 3 times a day for the elderly and 5 ml 3 times a day for the kids. Measuring cup and syringes are also provided to ensure that they get the correct amount and dose for each intake. Then, it is a must to educate the patient on how to use the drug in a right way in order to prevent any side effects. For instance, the pharmacy explained the bromhexine need to be taken orally if the medicine is in the form of liquid. The pharmacy need to ensure that the patient does not crush or dilute it in any solvent if the drug was in tablet form to get the maximum effectiveness of bromhexine. Next, provide accurate information on how to take medication including drug-drug interaction, side effect, and others. For example, the pharmacy need to know what medicine or herb the patient is taking or so that there is no drug-to-drug interaction. So, thus it cannot be harm to the patient. Patient also have to note about any side effect that might occur. If any side effects are too serious, they need to consult a doctor immediately. Overall, the pharmacy play a big role, not just give the medicine, but they need to ensure that the patient's safety by giving a good drug education.
For the last part of this video, I will explain about application use of bromhexine. So here is the 4 tips on how to use bromhexine safely. First thing first, before using this medication, talk with your doctor or pharmacist if you are allergic to bromhexine or any of the other listed ingredients in the products. It may cause some serious allergic reaction or some other serious problems. Number 2, as it comes in liquid form, use syringe to get the accurate dose. Do not use a kitchen teaspoon as it will not give the right amount of dose. Also, do not forget to shake the bottle before use. Next, be sure that you know the correct dose. It is important for you to take the dose that is prescribed by the doctor. If you forget a dose, take it as soon as you remember it. However, if it is nearly time for the next dose, skip the missed dose and continue with your regular schedule. Bear in mind that do not take double dose at any one time as it will lead to overdose. Lastly, for the storage, bromhexin syrup must be stored in a cool, dry place, for example at room temperature, and keep out of reach and sight of children. Do make sure the storage place is not exposed directly to sunlight. And that brings us to the end of this video presentation. I sincerely appreciate your attention and time for today. That's all from us. Thank you.